So thank you everyone for attending. I always look forward to these monthly meetings with all of you. Today we have a great topic on substance use services for youth. And we have Sutter Yuba Behavioral Health presenting today. We have Sutter and Yuba County Schools presenting today. And then we also have Sutter and Yuba Probation presenting today. So with that said, I will go ahead and hand this off to Philip Hernandez from Sutter Yuba Behavioral Health.
Thanks, Liz. Hi, everybody. Philip Hernandez, Sutter Yuba Behavioral Health. I am the SUD and Forensics Program Manager. So I guess I'm going to try to share my screen here so I can get my PowerPoint up. This is my maiden voyage as far as screen sharing. So we'll see how it goes. Liz, can you hear me?
I can hear you, and you should have access to do that.
Okay. All right, so I'm going to start with some definitions. So I'm going to go kind of quickly through the slideshow and then get to questions. But Liz will make the slide deck available to everybody so we can send it out. So if I'm going a little bit too quick, you'll get it all to review. But some definitions. Just want to talk about mental health care, where mental health is the treatment of individuals who are diagnosed and suffering from a mental health condition, which impairs their ability to function in social, emotional, occupational areas. Substance use disorder care is the treatment of individuals who are diagnosed and suffering from the use, abuse, or addiction to substances, including alcohol. Behavioral health care is the treatment of persons diagnosed and receiving treatment for either a mental health condition or a substance use disorder. And co-occurring or dual diagnosis is when individuals are diagnosed and being treated for both a mental health and a substance use disorder concurrently. Just a brief, I know that we talked about, Mark did a mental health presentation last week, but so this is just a little recap on mental health, which I'm going to skip over because I'm sure that Mark did a fantastic job last time. And here we are in the SUDS continuum of care. So all providers, the mental health plans, the managed care plans, private insurance, and Veterans Administration have the responsibility to the community to offer substance use treatment. There is a Medicaid parity rule that ensures that restrictions or limits are not more substantively applied on mental health and substance use disorder than compared to medical surgical services. In other words, the parity rule says that the substance use disorder treatment gets the same treatment as anybody else. So that is good to know. Sutter Yuba Behavioral Health is responsible for all SUD treatment for adults and youth who are Medi-Cal beneficiaries and or indigent. So we provide services to adults, and an adult is anyone over the age of 18. And we also most recently have begun to put together youth services. We don't have anybody actually in youth treatment services, but we are prepared to receive them. So if you have anybody out there, we're ready, willing, and able. We just need the bodies. A youth is considered anyone between the ages of 12 and 18, and the age of 12 is considered to be the holder of privilege. In other words, anybody from the age of 12 years to 17 can seek out substance use treatment and authorize the treatment on their own without parental approval. So just good to know. How does someone access care? Here is our open access flyer. And like I said, this will be in your slide bank that you get. But we have an open access clinic, and there are hours that we provide screening and assessment for substance use treatment. It's on Tuesdays and Thursdays from 8 a.m. to 3 p.m. Predominantly initiated by a phone call, but now that we're able to get back to in-person services, you can walk in the door and someone will see you. It's also good to note that if you have somebody and you're concerned about, or you have them in your purview and you want to get them connected to services, and you're not Tuesday or Thursday from 8 to 3, we just encourage you to pick up the phone and make a call. And most of the time you'll get connected with someone and we can arrange to bring somebody in for treatment. It's important we know that there's a short window of opportunity that people are willing and wanting to access treatment, and that window closes rather quickly. So we do have those open access hours, but we do take any calls or anybody that comes in outside of those times, and we usually have staff available. Center Yuba Behavioral Health provides adult and youth outpatient, what we call triage, screening, and assessment. We also have adult and youth outpatient group treatment. And then we have a adult perinatal intensive outpatient treatment program over on Garden Highway, which is called First Steps. And First Steps is women only treatment, and that predominantly for women who are pregnant and or parenting. And parenting are children under the ages of 17. So if you're have somebody that you're working with that's a parent of a child under 18, then they are a candidate for the women only treatment program at First Steps. In addition, if you have women with children that are under the age of 5, we also offer childcare as part of that treatment program. So the perinatal services, I think, are an important part of what we do in our communities. We also have a drug court program in both Yuba and Sutter counties. And the drug court programs are referred by defense attorneys and or prosecuting attorneys and or the judges can make referrals to the drug court programs. And then pretty much the same process, the triage, the screening, eligibility assessments happen before we make a recommendation to somebody being offered drug court. And that's a collaborative effort between Sutter Yuba Behavioral Health and the probation departments. Once we triage, screen, and assess people, we then refer into outpatient treatment. But if there are people that are requiring higher levels of care, we do that as well. So a higher level of care for adults, which often includes funding. There's conversation about whether we provide funding for residential treatment, and we do in most cases. Residential treatment is considered 30 to 90 days or a long-term 6-month to 1-year residential program that are no cost, low cost, such as the Salvation Army, Teen Challenge. Those kinds of programs are considered our no cost, low cost. And our local provider that we use is Pathways, the residential treatment program. And we oftentimes give Pathways the right of first refusal. In other words, if we have somebody come into treatment or for assessment and we're referring them to residential and we believe they're a candidate for Pathways, they're the first phone call we make. If that doesn't work out, then we reach out to our other contracted providers, Progress House, Granite Wellness, and we just recently contracted with Walters House in Yolo County. So, and sometimes depending on the type of treatment the person's been through, whether they've been through Pathways before, whether they have a conflict of interest, they know somebody there. I mean, there's quite a few considerations to decide whether or not somebody goes to Pathways locally or not. Excuse me. Pathways also provides withdrawal management. So oftentimes somebody is in need of detox, which is now called withdrawal management. And our first right of refusal is Pathways for detoxification prior to residential treatment. And this often is the case for somebody with an opioid use disorder or an alcohol use disorder, needing to have withdrawal management prior to entering treatment. And so Pathways does that. And then we also have an out-of-county provider that will access if there is no bed availability at Pathways. In addition to residential treatment, sometimes we will work with people who are in need of medication-assisted treatment, which is predominantly used for opioid use disorder, also alcohol use disorder. Medication-assisted treatment combines medication with therapy and case management. The types of medications that are used are buprenorphine, Suboxone, which are partial agonists, and naltrexone or Vivitrol, which are anti-agonists, meaning that they either partially introduce the drug into the brain or they block the ability for the brain to absorb the drug. So anyways, that's your agonist, your partial agonist, and full agonist, antagonist, sorry. And so the local providers that we have that do medication-assisted treatment, the WellPath Community Clinic is most recently opened in our counties, the Peachtree Clinic and Harmony Health. Those are the predominant MAT providers for those particular medications. Methadone, as many of you may know, the methadone clinics, the narcotic treatment programs, our local provider that the county contracts with is Aegis. We work very closely with them, and there's another provider in the county that does the methadone treatment as well. And the emphasis on treatment, because when somebody is considered to be a candidate for methadone or for an NTP, the referral to the NTP includes treatment. So they get the medication, they get their counseling, and they get their individual sessions there in the narcotic treatment program. Many times your other MATs, such as buprenorphine or Suboxone, Vivitrol, we will link those to a provider in the community, and then they'll come back to Sutter Yuba Behavioral Health to get their group counseling and individual counseling. All right, and this just outlines the other community providers that we work with. WellPath Community Care does MAT. They also have, they're talking about a methamphetamine track. I haven't, I don't know exactly what that entails, but I'm interested in it. Aegis does methadone, and the FQHCs does MAT. That's kind of a summary of that previous slide. Am I doing okay on time, Liz?
Yes, you've got about 5 more minutes for your presentation.
Okay, I'm doing good. So let's talk about youth a little bit, because youth is a challenging population, and I think that's what we're focusing on. And so higher levels of care for our youth that are in need of substance use treatment. I wrote in capital letters, none, or very limited, very difficult to access. We used to have a youth residential provider in the Bay Area that opened up about 2 years ago, and then they shut down, which they just couldn't get the numbers to sustain it. And it's my understanding that there are a couple in Southern California that are available for the Medi-Cal population for youth, for young people, and of course, the insurance providers. If somebody were to have insurance, then calling the insurance company and trying to seek out something through the insurance company, in my experience, is very difficult to find youth treatment, period, whether it's residential or not. So, and we'll talk about that here in a minute. And then I just made a notation that the Department of Healthcare Services is very much aware of this, the lack of ability to provide treatment for youth. There's a youth task force that's formed. They're working on the youth treatment guidelines, and they're working on systems of care for youth and trying to develop that statewide so that there is some ability to treat the adolescent population. Medication-assisted treatment in youth. Oftentimes we work with opioid-dependent youth under the age of 18 that are using oftentimes prescription opioids. However, we have come across some heroin users that are under 18. And so the medications that are regularly a component of adult treatment are not often used in youth due to the lack of FDA approval, and there's not a lot of published data. And also the youthful experimentation may not lead to a full SUD. So I hear a lot of times about, can we use MAT with an opioid use disorder in a young person? And that oftentimes depends on the provider, but as far as FDA approval, it's not approved. 18 seems to be where it starts. And I think there's some recent discussion about 16 years old as far as the buprenorphine or the Suboxone. But it is a challenge for youth, and oftentimes it's explained away due to experimentation. The other challenges with youth, which many of you probably have experienced, they're difficult to treat, and I would say difficult to engage. Just being able to get young people in to address to address any problem really, but substance use, oftentimes it's not a problem or it's explained away. Youth also who engage in treatment have a higher relapse rates than adults. They tend to get back involved with their peer groups, and there is not community support for the adolescent or the youth population that is out there for the adults. And so as a result, their relapse rates are higher. And the outcomes in treatment obviously related to those two, they have worse outcomes. And then the other challenges is the increased risk for injuries and violence when you get young people together in a treatment environment. I'm added a couple of just kind of data points just to kind of summarize. This is the Yuba County suicide rates over the 2020, the COVID period. It goes from 2016 to 2020. And we've heard a lot about suicide increases, especially during the pandemic. However, in our county, it hasn't proven to be that way, even though any death is too many. But you can see on the graph that there's 14 reported suicide deaths in Yuba County. Additionally, looking at drug deaths during the COVID, and this is talking about intent. So the blue line is accidental deaths, and the orange is suicide. And then there's another on there, and we're looking at in 2020 an increase in drug deaths overall to 21, and the dip on 2019 with 8 was an interesting data point, and I don't have an explanation for it, but it's something that I've reached out to see if I can't get a little more information on what happened in 2019, because if we can keep that death rate down, obviously that would be helpful. And opioid deaths, so the previous slide was all drug-related deaths. This is related to opiate deaths. 2020, there's a dip again in 2019, but there were 8 opiate-related deaths in 2020. So just kind of give an idea about kind of what the impact is locally. And I think sometimes, there's some national data about, 50 million people suffering from addiction nationwide. 15 million people have opioid use disorder, or 15 are alcohol use related disorders. But when you bring it home, I think that, these two data points here are interesting. So then I just thought, just to kind of seed conversation, community SUD service needs for adults and youth. My first thought in working with youth, I've been in Sutter Yuba County now for a little over a year, and working on youth treatment previously the county that I was before for 5 years, and now currently here in Sutter Yuba. Support activities for youth in most communities, not just ours. So I'm not blaming us, but it's really difficult to find support activities for youth, such as support activities for adults, NAAA, Celebrate Recovery. There's not as much for youth, and then you end up with an engagement. As far as engaging youth in those programs is difficult. The lack of youth residential programs, and also and then the lack of supportive housing, not only for youth, but also for adults. And so that's kind of to start the conversation and get people thinking about what that would look like. A little more challenging when you look at the youth population as far as housing is concerned, but something to think about. That wraps it up. So there I am. That's my contact information, and I'm open for any ideas or suggestions by email. So I'd ask anybody if you have thoughts or ideas related to improving access to care for youth, especially. I'm open to an email and glad to discuss that. So, questions?
I did have a question. Thank you. That was a very informative slideshow. I did have a question. I wrote it down, but I have lots of notes. You covered a lot of information. So again, thanks.
Sure.
Can you recap the first steps, just the age?
Yeah, the first steps, the age of parenting women. So up to age 5 is where we provide childcare. within the treatment program so that childcare isn't a barrier to treatment. So one can bring their children, from the age of birth to the age of 5, and we provide childcare for them while the mom is in treatment.
And mom is adult 18 and over?
Correct. Yes.
Okay. Great. And then drug court is also just for adults?
Correct. Yes.
Okay, perfect. Thank you so much.
Thank you.
Philip, is there a referral form for the youth program that you talked about that you said you don't have any participants for? That's my first question. And then the second question is, can you talk a little bit more about that and let us know what types of services are available through that program? And you were talking about 12 to 18-year-olds at that time, I believe.
Yeah, regarding youth.
Yes.
Yeah, and we're required, the county's required through the Department of Healthcare Services to provide such treatment for youth adolescent population. And so we have just came to a place where we're able to do that. I have a dedicated counselor that's working, that is prepared to work with youth. So the referral process is done with a regular internal referral form. And I know that they're available within the county, and I don't know where they go. I don't know how we do that from community providers into the county. I don't know, Mark, if you could help me with that or not.
Yeah, so we don't have necessarily a formal referral that we always use with other providers. Typically, most providers, we try to distribute the open access flyer because people can come in on a walk-in basis or call-in basis for open access. If they want to make a formal referral, we do have a referral form that folks can use, but we typically don't distribute those widely around to clinics and things like that. We just typically share the information for open access.
Thank you. And it's been something that I've been thinking about, Mr. Roper, about having a referral form for the schools, for the counselors in the schools, for other community providers to kind of get that paper link so that we're able to have a contact person and kind of close that loop. Oftentimes, a young person will get referred, and then the next question is, well, whatever happened to them, right? Because we don't know what happened. So if we have a hard referral, then we're often able to reach back out and let you know. However, because of some of the confidentiality and privacy rules, we can't always do that. But we do provide screening and assessment for anyone between the ages of 12 and 18. So if you have somebody, we're glad to bring them in and meet with them and see their level of need. And then we have a counselor prepared to provide group treatment services for the youth population. We don't have any youth in treatment right now, but we have been working with one in the Tri-County Hall who's close to being released from the hall that we're trying to bridge from the hall into treatment. So, the engagement piece and the relationship piece is really important when it comes to youth. So being able to meet that, that young person wherever they're at. And so if you have somebody and you're just looking to connect them, not even refer them in, but you want somebody to come out and talk to them, give us a call, because that's something I've been working on, to get our counselor to go out in the community and meet the young person wherever they're at. And then with that engagement, be able to bridge them into a more formalized treatment process. So we're welcome to take those phone calls and to meet those young people in the community.
And I'll add one other thing too about referrals coming from other outside agencies. So Kaya and I have actually talked about this in the past with other just general mental health referrals. It's really helpful when if somebody is sent our way, if the referring person also has our agency's release of information forms, because then when the person does come into open access, you can reach out to that. You as the referring person can reach out and say, hey, I referred this such and such, this person to open access. Before I did that, they signed a release of information that allows you to exchange information with me, particularly with drug and alcohol stuff. It's very difficult if we don't have a release on hand to kind of facilitate those like handoffs very well. And so what we can do is, I think, put the release of information form or have that sent out as an attachment maybe, like we've done with some of these other attachments on here. And that will help with, so that you can print some of those out. And if you do refer youth or adults to any of our services, it could be behavioral health or mental health or substance use services, fill out one of those referral forms and have the client sign that. And then once you have that on hand, then you can just, scan it over to the open access clinic or the provider that's seeing that person in open access, and then you can start that dialogue. Does that sound all accurate to you, Philip?
Yeah, good point. Thank you for that.
I'll see if I can find that ROI form right now.
Mhm.
Thank you, both Mark and Philip. Appreciate that.
Thanks.
So thank you, Philip, and thank you, Mark, for your presentation today. We're going to go ahead and move on to our Sutter and Yuba County Schools. And we'll go ahead and start with Amy Molina Jones next.
Thank you. So I did not prepare a PowerPoint, and I have one program to share. Really, we work on the side of prevention and don't dabble too much in intervention. However, we do run a tobacco use education program, R2B funding, and through our tobacco project, we offer brief intervention, which is a 2 to 4 hour intervention that our prevention specialists work with a youth individually and identify where they are in the quit stage and really get them to reduce use. And it's a harm reduction model. So we'll meet anywhere from 2 to 4 hours. Generally, it's 2 hours once the intake is done. And a student will then have an idea of what it takes to cut back or quit vaping or tobacco use specifically. That can also be translated and useful for a student that is experimenting with marijuana. And that's what we offer. Any questions? Virginia, follow that.
I have a question. I'm curious about, do you have youth participating currently? And then how do we get somebody referred over for that?
We, during COVID, probably had only a handful of students that were referred. And a referral takes place by just contacting our office. You can call me during the summer months. My number is 749-4994. And you can email me, and that's it for the referral. We generally get our referrals directly from school principals or vice principals, and then staff goes out to the school and meets with the student during a time that does not impact their educational needs.
And it's a one-on-one interaction?
Yes, one-on-one. We have also had school staff trained. So at one point we had someone in all of the middle and high schools in Yuba County trained. That's changed a little now just with turnover. But there are trainings that will be available in the fall if anyone's interested in brief intervention. And that's a 8-hour training itself.
Thank you.
I have a question, Amy. Do you know what the success rate is of that intervention? Is there any way to know that?
We really don't track past the first 12 months, and we don't have really hard data because we haven't collected it for more than 12 months. And really it's students are reducing in general, and it's changed from tobacco to vape, and it's really hard to calculate how much use is occurring with the vaping. So I think that's a no. We did just currently, or this year, we finished the California Healthy Kids Survey. So we should have some additional data around use as well. Anyone else? Okay.
So then we'll ask Virginia Burns to present next then.
Thank you. I'm Virginia Burns. I'm the program coordinator for student support and outreach here at Sutter County Superintendent of Schools. I'm essentially Amy's counterpart over here in Sutter County. So just a little bit about our programs. Amy just touched base on the tobacco use prevention program, but we also have we serve foster youth services, homeless services, a student mental wellness program called PrEP. We oversee SARB in this department as well, our county SARB. And then we also have a school counseling program, which is new. And then next year, starting August 1st, we're really excited. We're contracting out with the New Day Therapy to provide mental health in school-based mental health services to everybody outside of Yuba City Unified. And that's not on an IEP, just because those services were already in place. So we'll kind of review some of the things. So we actually do offer brief intervention with our tobacco use prevention education as well here in Sutter County. We embed it into an MTSS model with probation. So that's why I requested to go before Danya, because we kind of intertwine and we work together side by side in making sure that we are serving our students the same. So who we serve, so any student that's enrolled in a school in Sutter County, all of our schools in some capacity receive tobacco use prevention education services. They're free to our students because we write grants in order to bring these services to our schools at no cost to them. And then our districts, we contract out for our school-based, our school counseling program as well with our districts. So they provide a lot of the funding to support and continue that. So several of our school counselors are also trained in seeking safety, which is something that Danya will touch base with on a little bit as well. So again, we kind of, if probation's available to provide out, we may refer to probation, or vice versa. If they're impacted on their seeking safety trainers, they will actually contact us and we'll just make sure that somebody is receiving services and make sure those students are getting that. So that's actually an evidence-based program that addresses substance use and students who have been impacted with trauma as well. So that is available for that. It's one-on-one, we do it on one-on-one counseling. We also, again, with probation, we offer the change company journaling on a variety of topics, but more consistently is our brief intervention. And so we do use that in, we try to encourage in lieu of suspension, or it's written into a contract for a stipulated expulsion. So in lieu of expulsion, because they've been caught with substances on campus, they would refer to brief intervention, have to complete a substance use counseling program. So if brief intervention is identified as the appropriate place for them to be, then we do that. Otherwise, we refer up to CBT with probation or change company as well. So as far as I was going off of, Kaya had sent me a list of questions. So that was helpful, Kaya, thank you. So it is voluntary for the most part. A lot of our services are voluntary, with the exception of our brief intervention. A lot of that is written into a contract on many of our school sites. So it does help kind of increase engagement when they know that they're required to participate for that. But it is a harm reduction model, and it's kind of a in-between. It uses a lot of motivational interviewing techniques as well. What else? we have, and then we refer out to other programs as well. So if we identify, a lot of our school counselors have identified that a student is in need of additional substance use counseling beyond what we can provide, then we will refer out to probation as a provider, or we refer to behavioral health, or try to work with the families to identify an appropriate program for them. Questions?
You just answered my question. I was going to ask about when brief intervention was not enough. How you refer a student who is maybe more moderate or severe in their substance use, and you answered that. So hopefully we can work together because we have the capacity. We just don't have the kiddos.
Yes.
We have kids, so
bet you
be
do.
careful what you ask for.
Yeah.
Well, we need them. So
I think
Yes.
Virginia and my ears both perked up when we heard that you have a program but no kids.
yeah, I know, Amy. Yeah, both of you actually. And probably should connect you with the youth SUD counselor that's working here. So I'll work on that.
Yeah, absolutely. And then again, Danya and I, we actually met before this meeting, just because our programs, we integrate them so much and make sure that our schools are informed of the program, so we can do referrals to their programs and vice versa and work together. So on that note, I will referrals to the programs, you contact our office. Do I have the ability to share screen? Here we go.
Yes, you do.
So I can send this out. This is our RAC card. I will update it though. It is outdated, the second page, the back of it. But you can contact our department and refer, or you go through your school counselor, and they'll get you set up with services as well. And Yuba City Unified, they have their own 2P program, but they align with it. It's very similar. They also provide brief intervention and do referrals to probation for as needed as well.
Is the brief intervention, are you training the school counselors on the brief intervention?
So with Yuba City Unified, the school counselors have been trained. They have identified school counselors. So not all of them, I don't think. I could be wrong. I think they have a 2B identified person at each site. And so they're trained to implement brief intervention. And then here in my department, the intervention specialists are trained on brief intervention. The counselors are trained in seeking safety and some of the other evidence-based programs that they provide.
And Virginia, you and Amy are working with foster and homeless youth. Is that correct?
That's
That is
correct.
correct.
You're working at the at-risk population. Okay.
Yeah, and we both also have our peer resource engagement program, which is a mental health awareness program that is peer-led within our schools, and both counties have that as well.
Cool.
And Philip, a lot of times we use Rudy as a resource, but there's one Rudy
Right.
for both counties and all the schools. So and that is another resource for us.
Yeah, Rudy's great. And like I said, the treatment portion for youth just got the wheels on it. So it hasn't been an option till now. So
Super exciting.
We would love to hear more.
Yeah.
Thank you.
Thank you.
Any other questions?
Okay, thank you, Amy and Virginia. I really appreciate your presentation. We'll go ahead and move on to Danya from Sutter County Probation.
Hello, everyone. I'm gonna go ahead and share my screens. This is just part of a brochure that I sent out. Let's see. All right, can you guys see that? Perfect. So I did send this in to be pushed out to everybody. This is just part of the brochure, some of the programs that Virginia mentioned. So we have several programs here at Probation for youth. They are available to anyone in the community, not just kids on probation, and they are free as well. We all serve ages 12 to 24. So we're also serving that transitional age youth population. We've had referrals from schools, referrals from probation officers, referrals, self-referrals. So we just have parents call sometimes and want to get their kid into programs. We've also been on site at schools seeing youth, and their friend will come in and ask for services as well, which is always nice. Love that. So self-referrals. All of our programs are offered individually, so we don't do any groups, but we meet with the youth one-on-one. And it's a harm reduction model, just like everyone said so far. Adolescents tend to be pretty challenging population. They're my favorite, but they are challenging. And so anytime we can help them in any area of their life, it's definitely going to affect their use of substances. And if that's, if we're seeing success in other areas, we call it a win for sure. So it is a continuum of care. So as Virginia said, sometimes they start at the school with brief intervention. If it's a school referral to us, we then do an assessment when they come in. We have one probation officer and one intervention counselor that are dedicated to all of our programs and providing substance abuse, our substance abuse curriculums. So when we get a referral from the school, we're going to do a screener and assessment to see kind of what level they're at. So the base level that we have is the change company. It's on the flyer there. It's forward thinking, and we kind of assess whether or not they need if they're just simply using marijuana. We have a marijuana journal that we do with them on a one-on-one basis. If it is marijuana and or alcohol or other drugs, we will then do the substance using behaviors. And that, I can't even put a time frame on how long it takes a kid to do a journal, because it's really individual as to how quickly they make it through that, and how quickly we can engage them to complete all of the sessions. We focus a lot of time on engagement. So we use motivational interviewing, we phone calls, texts, home visits, school visits, you name it. We're out there hitting the ground to see these kids. A lot of them we actually see on site at the school. We will pull them out of class. The schools have been so supportive of that, but they're a captive audience while they're there. So that's where we try to hook them in. During this past year, I think we were pushed out of our comfort zone, which was great. So we've been engaging kids virtually, which we've had really good success with. They like to FaceTime and or Google Duo. So that's actually worked out. And then the next level up, so if they really are past experimentation and in that abuse phase, we use what's noted on the form there is cognitive behavioral therapy. The program is actually called Encompass. And it's anywhere from 14 to 16 weeks where we're working with the youth, not just on their substance use, but we really try and delve into what are the underlying needs that aren't being met that is pushing them towards using. And so really addressing those issues as well. And a lot of times, especially for youth that are just getting into substance use, it's a lot of boredom and not having things to do positively in the community. So talking back to what Philip said, there's not a lot of youth community things in our area that are free to kids, with transportation and all of the things that our kids don't have a lot of access to. So, and I would say the majority of the youth that we see are in those programs. We do have a higher level of care and intensive outpatient. We use the matrix adolescent model, where we're seeing them at least 2 days a week. That usually tends to be our transitional age youth population that meet criteria for that program. Referrals, I did also send out, so the referral forms can be emailed to all of you. You can just call our office, you can fill out that referral form and email, fax it, drop it off, you name it. You can also just have youth and parents give us a call if they're motivated to make that happen. But we will take referrals any way we can get them. I will stop sharing. Let's see. All right. Any questions? That's a lot.
Thanks, Sonia. You've given Martha and I some good information and kind of sparked a little fuse there.
I'm available anytime, ladies.
Yes, I agree with Amy. I actually met with Danya and Virginia yesterday and got some ideas of how they collaborate very well. So me and Amy will definitely be connecting.
Great.
We also train the change companies journaling for community agencies. I'm not sure when our next training will be, but we provide that as a free training to anyone available to attend as well. So.
Thank you.
Thank you so much, Danya. That was really great information. Martha, would you like to present next?
No, I'm just kidding. So I'm Martha Hernandez. I'm the interim program manager here at Yuba County Probation. Our population that we target is 12 to 24 years old. We have the same thing that journaling as Sutter County does. That really is just education, and that targets are kids that are not going through court, like referrals from the schools, juvenile traffic, self-referrals. And they're kids that are on probation, but don't need the intensive. We have a substance abuse counselor and we have an intervention counselor. If the youth needs more intensive services, they'll be assessed by our substance abuse counselor, and depending on their needs is what she provides. Kids that are on probation, we kind of have a little more, pull because the court orders the treatment, but they also have to be willing to participate. So we use incentives. We meet them at their schools, home visits here at the office. But that's kind of what I have. Not as detailed as the other participants, but that's what probation's doing right now. But I am going to meet with Amy and try to get some collaboration going on for sure.
So Martha, I have a question. And actually, Danya, thank you. It's funny. It's like we communicate often, but it's like you learn something new every time, right? So I got a better understanding of what's going on there, which I appreciate. But Martha, when Danya was talking about that they provide treatment for adolescents that are referred, whether they're on probation or not, is that the same on the Yuba County side?
Sorry, our substance abuse counselor is more for probation youth that are actually on probation and have gone through the court system. We will take the referrals for the journaling program for the ones that are not on probation.
It'd be great if Virginia and Amy and you and Danya get together. I'd like to be invited. I think it would be great if we could work together in a continuum and support and find the appropriate place for the young people to go.
I agree.
As do I. And so does Virginia and Danya.
That was going to be my question. Like, is there a group of people that are working on this topic? Like, I know Amy and Virginia, like we recently put together a committee that is focused on homeless youth. And I just wonder if there's already a committee working together to focus on youth with substance use behaviors. It's such a huge thing. And like, if there's not already something in place, I know there's Children's Council and there's some other groups that meet, and I just don't know, like,
Yeah.
I
kind of feel that it dovetails with the prevention network. And I don't know if Kathy LeBlanc, I see her name, but Kathy and Jason, I don't know if you guys can weigh in on that thought. And Liz, sorry. But that.
So we also were invited and we started participating in, is it one of the behavioral health, one of their meetings, they're collaborative. And so it sounds like our voices were heard, because that was one of the big things that Amy and I kept repeating, and several of us just kept repeating, is that there still is a gap in our community to serve the substance use needs and for youth. And so we are really grateful to hear this, that you heard us. Well, it wasn't just us, but we were the squeaky wheels.
Keep shouting.
This is Kathy. I am on the call. substance abuse prevention in the foothills is desperately needed. I would love to work with Amy and whomever else that wants to be a part of this endeavor out in the foothills. Currently, what we're doing in the prevention work wise is we're working on a grant called All Children Thrive, and the communities of Dobbins and Challenge are IDing where their gaps and their strengths are within their community. Substance abuse for youth has not been pinpointed exactly, but as we get further into this process, I'm sure that will come up, and any resources or maybe even presentations or things of that sort as we move forward would be welcome.
And I just want to add, for those of you who aren't familiar with the Prevention Network, that is a subcommittee of our Children's Council in Yuba County. And ultimately, we're focused on early prevention for families on abuse and neglect. So, we're looking at those early interventions that we can do to help prevent them to getting into the child welfare system. So that is a work group that is participating in the ACT with Kathy LeBlanc on that. And we got some super exciting things happening with that. And then on that note, we're nearing the end of our meeting. And I just really want to thank all of you for attending today. You guys make this what it is. And I definitely will be sending out all of the pamphlets and presentations from today's meeting. And I do want to remind you that our July 28th meeting will be regarding navigating medical care. And that'll also be from 12:30 to 1:30 as well. And we will be posting videos soon. We've got the videos formatted and ready to upload to YouTube. So we're just working on getting them uploaded. So as soon as those are available, I will be emailing the group on those as well. And I want to thank everyone for your time, and I hope you have a safe 4th of July. Take care, everyone.
Thank you, Liz.